angle, and I'm going to be fulcrumed on the 3-5. Because there's a missing tooth, I have to reach a little bit to get back to that 3-8. So this is where my fingers are going to come up the handle a little bit. So I'm going to insert at the distal lingual line angle on the 3-8 with my tip. Try to get your shank as vertical as you can and start your activation, your knocking, and you're going to roll around the distal line angle and come up. Turn your tip around, reinsert at the distal line angle, and we're going to do our knocking stroke again as we come mesially. Pivot up as you come to the mesial and get ready for a roll around the mesial surface and coming up vertically. 3-7, insert at the distal line angle with your tip. Start your activation. Make sure you're activating with your wrist. Go into the distal and come up vertically. Roll your tip around, reinsert at the distal line angle, and now we're going to come across the lingual surface with our oblique strokes. Pivot up as you come to the mesial, roll around the mesial line angle, and come up vertically. The 3-5, I'm moving my fulcrum now into the anterior teeth. Insert at the distal line angle, roll around the distal surface, come up vertically, come out, reinsert my tip, and we're going to come across the lingual surface and roll, pivot up, roll around into the mesial and come up. And the 3-4, I'm fulcrumed on the 3-2. Insert at the distal line angle. Nice wrist activation. Try to keep your stroke short. Come across the lingual with your oblique strokes. Pivot up and roll into the mesial, keeping a nice straight terminal shank.